Hi everyone, I'm Donna Wells with CDHA. This question and answer session about care calls with clients is part of a video series produced by CDHA to assist dental hygienists in having positive conversations with employers as they return to work post-COVID and to pursue collaborative relationships for healthier workplaces in the future. If you have not watched the introductory video, it would be a good idea to do so because it will help you better understand the frameworks that will be discussed. At this time, I'd like to introduce you to Catherine Eitel-Belt, a communication expert in the dental profession. Thank you for joining us, Catherine. Can you tell us what care calls are and what they consist of?
Thanks, Donna. I would love to talk about care calls. I think they're one of the greatest gifts that has been born out of the COVID crisis. Care calls are really an outreach from the dental practice to get in touch with their patients, to communicate to their patients that we're thinking about them, that we care about them, that we want to be a resource for them, to help them in any way we can, in particular to help them with maintain their oral health and to get their questions answered about how it will be to return to the office when we do. So that's essentially what care calls are about. And so basically what care calls consist of is a check-in with the patient just to see how they're doing personally. It's also going to include, assuming they're not in any kind of high stress or high trauma situation, then you would go forward with some other components like checking in on their home care status, how they're doing with that, if they have questions, if they need resources. We're going to sort of feel our, as patients respond positively, we'll keep going with, do they have any concerns or questions about their current dental treatment or dental, maybe some, situations that they're experiencing in their mouth. Also, we will make sure they feel or understand what we're doing behind the scenes to make sure that it's going to be safe for them to return very soon to our offices. And just to really make sure that they feel comfortable and that we check in. What we're hoping to accomplish is that they feel cared for. At the same time, we're proactively getting them, keeping the practice top of mind and proactively getting them feeling good about coming back to see us really soon. So that's kind of the purpose and the overview of the care calls.
So why is the dental hygienist best suited to make these calls?
Well, I think they're particularly well suited and really the perfect candidate for these calls. And the reasons would be the depth of their relationship, the strength of that relationship, and the breadth of their experience and education. So in terms of the relationship, if you think about it, dental patients see their dental hygienist often more frequently throughout a number of years or their lifetime in a practice than they do almost any other position in the practice. And because of that, hygienists, we often feel like our dental hygienist is someone we can be open with, we can ask candid questions, we can trust them for, really good answers or answers that, can really help us. And so I think because of the depth of the relationship, because they're on such a comfortable footing, it's a good person to make the calls. It feels like a friend is calling, really, instead of a stranger. So that has a big upside. Speaking about the experience, because a dental hygienist has so much education and so much access to resources and tools, they can give good advice. They can give really great, a lot of direct people to resources that maybe other team members might not be aware of. So I think there are some really solid reasons to have a dental hygienist make these care calls to patients rather than just anyone on your dental team.
Great. How would the dental hygienist approach their employer about making these care calls?
So approaching your employer about making these care calls is no different than approaching your employer about anything you want to have happen. You're going to want to follow the ARCH formula, which of course we covered in our introductory video. And you're going to want to remember that the strategy is to partner with your dentist in delivering the best quality care and in protecting the practice brand and in delivering service to patients. So when I think about preparing for this conversation, I consider what might be the position of the dentist. What might be some possible concerns that they may have. And I remind myself to stay non-defensive, to really get in there and try to understand first their perspective and their concerns. And then after I've listened to those, to maybe offer some ideas that would showcase the fact that I want us both to win on this. I'm not expecting a win just for myself. I'm wanting a win for both the dentist, the dental practice, and the dental hygienist. So think partnership. Think, let me help them feel understood. Let me help them feel heard. And then let me add to that with some ideas. I think part of the way we do that is we show up with some well thought out suggestions. We show up with some enthusiasm, some optimism, some excitement and passion around this. And we show up with genuine concern for not only our own interest, but for the interest also of the dentist and the dental practice and our patients.
Great. What if the employer has concerns over having a dental hygienist make these care calls? So some concerns might be, we talked about having the dental hygienist versus another staff member, the responsibility of having to open their office to have a dental hygienist go into the office to have access to records to make these calls, maybe being concerned that the client may be bothered by having these calls. How would you recommend responding to those concerns?
Well, I think all three of those are valid concerns. And I think any dental hygienist listening to this video would agree that we might not agree with the actual concern itself, but we could understand why a dentist would have those concerns. A couple of them are financially motivated. Any business owner is looking for the most effective and inexpensive way we can get something done. That makes good business sense. And so if we just non-defensively look at that, we can understand why that would be a concern. And so I think, let me take those one at a time and maybe demonstrate, if I could, how that might sound for us to respond to that in a really positive way. So if you had just said to me, or a dentist had just said to me, you know, I'm interested in this idea, but I don't know why I would need you to do it at the pay scale I would pay you versus someone that I could pay a lot less. Then I would respond, and I would encourage your viewers to, if they've watched the introductory video, notice how I'm following the ARCH framework here. So I would say, well, you know, I really understand that. I think it's really wise, and one of the things I appreciate about you is just how great a business person you are on top of being a great dentist. And so I appreciate that you should be looking for the most effective way and inexpensive way to get this done. I would like to suggest that I think it's a great investment in this process to have someone who has the depth of relationship that I have with patients, so that it feels like not just anybody from our office is calling, but an actual friend, somebody who knows and understands their care and knows and understands them. I think there's also a really big and strong benefit to my experience and my level of knowledge to be able to answer their questions appropriately and to be able to really help them feel secure about coming back to the office in terms of our infection control protocols and things like that. So I would like to suggest that we find a way to make these profitable and productive for the practice by utilizing my level of experience and the depth of the relationship I have with your patients. Okay, so you can see, Donna, that I'm not being defensive, I'm understanding, and I'm suggesting that we could partner. It's almost, you notice I didn't say the word but. I understand that, but I think I'm a better choice. The but is something you want to avoid. You want to insert the word and. So in that scenario, I'm saying, I get it. And I actually appreciate that you're looking for a really efficient way to get this done. And I'd like to suggest this is an efficient way. I think that I can be a great, productive resource for you in these calls. So, you have to make your case. You have to come prepared with some tools there. One of the other possible concerns that you illuminated was the concern that we have to show up in the office. So again, I might say, let's assume you have some software that I have the capability of logging into remotely. So I might come with a plan to say, I've already done a little research on the capabilities of our practice management software. And it's my understanding that we have a secure way of logging in remotely. And I agree with you. I think we are going to want to make sure that all of these calls are documented in the patient's record and that we have a system, an organized system for follow-up. And so I've put together a little plan, and I'd love to show to you how we could make that happen remotely. If you are in paper charts and you haven't yet, started to use electronic records, then again, you just need a plan to say, I've thought about that, and I know that we're going to have to be very careful about coming into the office. So here's the plan I've worked out. I'd be happy to spearhead it and work up a schedule where we could come in and still be safe and get these calls done. So you're looking to partner, you're looking to bring some answers and some ideas around this so that they're not having to generate the answers to their own questions. And so the last concern that you articulated was the concern about whether this might come off as pushy or too salesy or too aggressive, maybe just bothersome to a patient. And I think we could all understand that concern, and none of us would want that to be the end result. So just say that to your dentist. Say, I totally 100% agree. I couldn't agree more. The last thing I want is for them to feel any of those things. And so I've done some research about how exactly would we have these calls? What verbiage would we use so that we absolutely make sure that the end result is they feel cared for, they feel that we have been attentive to their questions and their needs, that we have helped them to keep their oral health at the forefront of their thinking, especially during this crisis where we're wanting immune systems to be strong. And, as we go back out into the world, it's easy to make the case that keeping their dental health, their oral health at the forefront of their thinking is important. And I think dental hygienists are perfect for that conversation because they have it all day long, every day with their patients. So I think I know the Canadian Dental Hygienists Association has produced a video. So maybe you mentioned that. You can say, my association produced a video on exactly how to have these calls, and I've studied that video and I feel really well prepared. I'd be happy to share it with you so that it could ease your concerns about how this would sound. But I think just, what you're starting to see is I'm partnering, I'm not defensive, I'm offering I've come with a plan and I've come with some ideas well thought out, and I'm excited about them and I'm passionate. One of the things that I love to say or suggest that a hygienist might say is to say, I really care about you and your practice and my role in the practice. And I want you to succeed. And I think making these calls is a big step in that direction to help us, when we get back into the office, be ready to have an amazing second half of 2020. And I'm committed to that. If you stay in business and are successful, then I continue to have a job. I continue to be able to care for my patients and be a part of a team that I love. And so I really believe that this could be helpful to you. Not just to me, but helpful to you, to the practice, and to our patients. So I think if you make it a win-win and you let them know that I'm thinking about this because I think we can all benefit greatly from it, I think it goes a long way.
Wonderful. Any further thoughts you have on care calls or recommendations you may have for dental hygienists as they talk to their employers?
Yeah, just make sure that you're very well prepared with the reasons why this is good for all those parties. So the patients feel cared for, the patients, we help them keep oral health at the forefront of their thinking, which will hopefully cause them to put it as a priority when we start to return to work and open up our dental practices to care for them. It also lets them know that we are a resource for them and that we don't just care about their money, we care about them as human beings and as part of our community. So, you know, go prepared with that, and why the reasons why you're a particularly good choice for these calls. And I really believe that practices who invest this time and this training will do better than those that don't. So I think that's, you know, it's a super important topic.
That's great. Thank you so much, Catherine.
You're welcome.